Hello, everyone. On the behalf of NU 469, Brittany Smith, Erica White, and Charles Clark would like to talk with each of you today about hepatitis. But before we begin, let's discuss a few learning objectives that I hope all of you will learn following this presentation. We will be discussing the definition and the patho of hepatitis. We will also list and describe each of the viral hepatitis. We will talk about the common signs and symptoms, the risk factors, as well as the transmission routes. We will also discuss the incidence of hepatitis as well as the ethical issues that it may present. And we will also discuss the effect that hepatitis has on an individual as well as society and their family as well. First, let's start off by talking about exactly what hepatitis is. Hepatitis is a disease that is caused by inflammation of the liver. It is commonly caused by a viral infection, but sometimes other causes such as medications, toxins, alcohol, and even autoimmune can cause hepatitis. There are 5 types of hepatitis, which are known as hepatitis A, hepatitis B and C, as well as hepatitis D and E. Next, let's talk about the pathophysiology of hepatitis. Hepatitis begins when there is damage to the liver cells, and it is caused by immune response. Next, this is where alterations in your liver function begins to happen. An individual may present with fever, fatigue, or even jaundice of the skin. Did you know in 1963, Dr. Baruch Blumberg discovered an antigen of hepatitis B in blood samples? In 1967, Dr. Blumberg and a colleague of his invented the hepatitis B vaccination. Next, let's talk about exactly how hepatitis is diagnosed. There are several different liver function tests for each type of hepatitis viral infection. Some liver function tests there is albumin, AST, ALP, and also bilirubin. Albumin is a protein that is produced by the liver to help minerals pass through the bloodstream. Did you know that 1 to 5% of people with hepatitis C will die from cirrhosis or either liver cancer? That is why it is so important for individuals to understand how and why the liver is so important. Your liver helps flush out toxins in your body, as well as it produces bile, which is an enzyme that is needed for digestion. Hepatitis is a very distinct disease that affects your liver and can cause many types of health problems.
My name is Erica White, and I'll be talking more about hepatitis. There are 5 types of viral hepatitis, which includes A, B, C, D, and E. And there are 2 other types of hepatitis, which are alcoholic hepatitis and autoimmune hepatitis. Hepatitis A, it is acute. It's usually acute and short term, and it resolves within weeks to days. It is preventable by a vaccine, and it is a highly contagious liver infection caused by an infection caused by the hepatitis A virus, also known as the HAV. It is most commonly transmitted through food or water from a person that has been contaminated with hepatitis A. And one of the treatments for hepatitis A, one of the main treatments is adequate rest and hydration. Hepatitis B is a liver infection caused by the hepatitis B virus. It's easily preventable by a vaccine. This vaccine is one that your employer offers. It's a series of 3 vaccinations, and your employer offers it because you have risk for you come in contact with occupational bodily fluids. And this is a series of vaccines given every 30 days. It's a total of 3. Most employers offer it. If you're interested in it, you should ask your employer. Most people are asymptomatic, especially children, and it's sometimes spread by sexual contact. When a person is exposed to bodily fluids from an infected person. All these hepatitis are spread by those people who are already infected with the viruses. And this condition usually clears up on its own. Hepatitis C is an infection caused by the virus that attacks the liver and leads to inflammation. Now, hepatitis C is becoming more prevalent now. This is one of those hepatitis that's spread by, it's the most common blood-borne viral infection in the United States. This is caused by unsterile needles, like people who have a lot of tattoos. They might find out later that they have hepatitis B or C. And this is also caused by needle sharing as far as like IV drug users. This is treated with antiviral medications, and these medications can eradicate the virus. The thing about hepatitis C, antiviral medications, they're really expensive. Like a 3-month treatment can cost up to $90,000. So there are a lot of guidelines that a person must meet in order to even get treatment for hepatitis C. Hepatitis D is another infection caused by the hepatitis virus. It's spread easily, and it can last for years, or it can be a lifetime condition. It's also known as the Delta hepatitis, and this only occurs, hepatitis D occurs as a co-infection with hepatitis B. So a person must have hepatitis B in order to even get hepatitis D. And a treatment for hepatitis D is usually supportive care, but once you treat the hepatitis B, hepatitis D will mask it. Okay, hepatitis E is another type of infection caused by the hepatitis virus. It is transmitted through drinking contaminated water and fecal matter that's similar to hepatitis A, but it's not common in the U.S. It's more common in the Middle East, Asia, Central America, and Africa. It's mainly in those areas with poor sanitation, like some third world countries, and it's typically spread by ingesting these contaminated fecal matter, like some people drink out of rivers, or how people may consume food or water that's come in contact with like animals. The other 2 types of hepatitis include alcoholic hepatitis and autoimmune hepatitis. Alcoholic hepatitis is caused by long-term use of chronic alcohol consumption. It causes the liver to become inflamed, but this doesn't occur if you drink a few drinks like socially. You have to be a chronic alcohol user, like you have to consume alcohol every day for years. And the autoimmune hepatitis is when the immune system attacks the liver. Although the cause is unknown, autoimmune hepatitis is very rare as well. Your body makes antibodies to fight against the liver tissues, but they're still not sure how it's caused. It can be controlled by drugs that suppress the immune system. And with the alcoholic hepatitis, in order to treat it, first you have to stop drinking. And then you have to take steroids that might help decrease the inflammation caused from the chronic irritation that has inflamed the liver. All right, so the routes of transmission. Like I said before, hepatitis C is becoming more prevalent in today's society. And as you see, 60% of the transmission is caused by injectable drug use. So a lot of people who use these injectable drugs are at risk for this hepatitis C. And so it's the largest portion of active, cases. 15% is caused sexually, but it has to be with a person who's contaminated or already infected with the virus. This is usually hepatitis B, and in a few cases, some of the other ones. Transfusions, that was before screening, before they started screening the blood, but they don't really get as much hepatitis now from blood infusions because they do so much cross and match cross screening, and they really take good care of the blood to make sure it's clean. Occupational causes, that's including like needle sticks, so that's why I was telling you about the importance of the hepatitis B vaccination that your employer offers. Unknown is 10%. The unknown can be some of the tattooing that's caused by hepatitis C, or like consumption of these contaminated foods or fecal matter. Contaminated caused by fecal matter in these foods and this water. That's the hepatitis, like the hepatitis E that I mentioned. All right, so the incidence of hepatitis. Many people don't even know that they're affected. The way that people find out they're affected, they might go to the doctor because they're feeling really tired or exhausted. They just have been feeling bad for weeks. But the reason this happens is because their liver enzymes are out of whack. Their liver enzymes are usually elevated, and their blood work is just not right because they become infected with this virus. They said, according to the CDC, approximately 4.4 million Americans are currently living with a chronic form of hepatitis B or C. Okay, so just an overview of the different types of hepatitis. Hepatitis A is very rare and is fewer than 20,000 cases a year. Hepatitis B is more common and affects greater than 1 million people annually. More than 780,000 people die from hepatitis B annually. Hepatitis C is more common now, and it causes greater than 500,000 deaths annually. Hepatitis D has fewer than 200,000 cases a year. Hepatitis E is very rare, and this is usually in those third world countries or those countries with poor sanitation, and it occurs in less than 20,000 cases a year. Alcoholic hepatitis is rare. Fewer than 200,000 people are affected annually. And immune hepatitis is rare as well, and the cause is unknown. Here's just a chart. I'm going to include this on the PowerPoint if you want to look at it later. It just tells the different types of hepatitis, A, B, C, and E. These are the most prevalent. Well, E is not that prevalent, but it just gives you a synopsis of how it affects the liver, how many people are affected, and how you can improve it, how you can avoid it. Like hepatitis A, it says improved sanitation will help with that one. Hepatitis C says antiviral treatment can help with treating those patients. Hepatitis B, it's just saying it's important occupational hazard for healthcare workers. Hepatitis E, it says China has produced a licensed first vaccine to prevent hepatitis E. You really don't hear much about that in the U.S., but I'm quite sure over time it will become more prevalent.
Hello, my name is Charles Clark, and I will be discussing with you the risk factors. With hepatitis A, the risk factors associated with that is contact with contaminated food or water, people living and traveling in areas of the world with many cases of the disease. In hepatitis B, some risk factors include injection drug use, sexual intercourse with an infected person, sharing razors or other sharps with an infected person, and babies from an infected mothers, healthcare and public safety workers, and people who get tattoos with unsterile needles. People at risk of hepatitis B might also be at risk for hepatitis C. Hepatitis C, some risk factors, direct contact with infected body fluids. This is usually through injection, drug use, and sexual contact, injecting drug users, also hemodialysis patients, and people having sex with an infected partner. Hepatitis B risk factor is being infected with hepatitis B. It occurs as a co-infection. Hepatitis E is the consumption of contaminated water, kind of like what you would see in like a third world country, river drinking. Risk factors, you have an autoimmune hepatitis, the female gender, genetic predisposition, and immune dysregulation. And with alcoholic hepatitis is consumption of large amounts of alcohol used for many years, which can cause that alcoholic hepatitis. Signs and symptoms of hepatitis. Hepatitis A, you have fatigue, nausea, abdominal pain, loss of appetite, and a low-grade fever. In hepatitis B, you have the yellowing of the eyes and skin, abdominal pain, and dark urine. With hepatitis C, you have fatigue, nausea, loss of appetite, yellowing of the skin and eyes. With hepatitis D, you have abdominal pain, nausea, and fatigue. Hepatitis E, jaundice, lack of appetite, and nausea. With alcoholic hepatitis, you also have yellowing of the eyes and skin, increasing belly size due to fluid accumulation. This is called ascites. And in autoimmune hepatitis, you have fatigue, abdominal pain, joint pain, and discomfort. So as you can see, a lot of the different hepatitis have generally some of the same signs and symptoms. Now we'll be discussing with you ethical issues relating to hepatitis. IV drug users represent the largest single risk group. Hepatitis C infection among intravenous drug users occurs at an alarming rate. Sexual contact has also been identified as a means of transmitting hepatitis. Several studies of risk factors in sexual activity found rates among active homosexuals 1 in 18%, heterosexuals 1 to 10, and female prostitutes 1 to 12%. Approximately 2% of all hepatitis B cases are thought to be contracted through occupational risks, like nurses, doctors, anybody that comes into contact with hepatitis patients. These involve needle sticks and blood spills are most common. Prisoners also have a great incidence of infection. For example, in California, prisons exceed 80%. Caucasian Americans statistically counted for the most infected individuals, with African Americans counting for the highest incidence rates. The highest prevalence of the disease was found in middle-aged people. That includes people the ages to 30 to 49, which accounted for 3% to 4% of the cases. And prevalence of black males in that group approached 9 to 10%. Gender is not a significant risk factor in the population as a whole. I will now discuss how hepatitis affects the family, the patient, and society. Hepatitis C has been associated with tremendous clinical, economic, and quality of life burden. Hepatitis C virus has been considered the leading indication for liver transplantation and the leading cause of hepatocellular cancer. HCV infection has imposed a high economic burden on the U.S. health systems. Over the next 2 decades, the costs and incidents are expected to increase tremendously. Viral eradication of hepatitis can improve important outcomes such as mortality and quality of life. I will now discuss just some plan of care that we would use with patients with hepatitis in a hospital setting. Our nursing priorities would be to reduce demands on the liver while promoting physical well-being. We want to prevent complications. We want to enhance self-concept and acceptance of situation. And we want to provide information about disease process, prognosis, and treatment needs. We want to have some discharge goals, such as meeting basic self-care needs for patients with hepatitis. We want to prevent and minimize complications related to hepatitis. We want the patient to be able to cope with the current diagnosis of hepatitis, the disease prognosis process, and therapeutic regimens related to the care of individuals with hepatitis. And we want to plan and schedule follow-up appointments and make sure those people keep their appointments. Also, recommendation to support groups as needed. Plan of care problems. You want to As discussed earlier, you'll have imbalanced nutrition, less than vital requirements. They will also have deficient fluid volume, fatigue. They will have impaired skin integrity, and also knowledge deficit. Plan of care management, an infectious disease specialist to treat the disease, a gastroenterologist to follow with after treatment, nursing to assist MD with care of the patient, dietary for nutritional support, and phlebotomy because these people will need a lot of serial lab draws to monitor the disease progression. Occupational therapy, physical therapy as needed, recreational therapy. They will also need a social worker to assist with finding resources, and a pharmacy, of course, with all the many drug needs.
All right, so to summarize our presentation, I'm just gonna hit a few points. So in review, there are 5 types of viral hepatitis, which include hepatitis A, B, C, D, and E, as stated earlier. Hepatitis is an infection caused by the inflammation of the liver, which causes changes to the liver. Hepatitis affects the liver's production of the bile. When this happens, that's when you get the jaundice, which is the yellowing of the skin in the eyes. Chronic infections cause scarring to the liver, which is known as cirrhosis. In 1960, hepatitis B was discovered. In 1970, hepatitis A was found and named. In 1989, hepatitis C was isolated and named. Hepatitis D was identified in Italy in 1977. It was identified in those patients with hepatitis B. That's why it's a co-infection. In 1990, hepatitis E was identified. The liver is very important to your body's metabolism. That's why when your liver is affected, it kind of affects the whole body. That's why this hepatitis is very, very crucial. It's a very crucial disorder. It's diagnosed by performing diagnostic testing. Each type of hepatitis is treated depending on the viral strand. This just tells how they're spread again. Hepatitis A is spread from infected food and water. Hepatitis B is spread by exposure to infected bodily fluids. Hepatitis C is spread when the blood from an infected individual comes in contact with that of a non-infected individual. Hepatitis D is spread as a co-infection with hepatitis B. Hepatitis E is spread by consuming contaminated food and water. And the other types of hepatitis are alcoholic and autoimmune. The alcoholic is a chronic hepatitis that occurs from years of consumption of large amounts of alcohol. Autoimmune is unknown. The cause is unknown. The most important thing on this slide is that some people remain asymptomatic. Some people don't even know they have hepatitis, just go to the doctor because they're feeling really, really bad. But after testing, it comes out that they're positive for the hepatitis antigen. Hepatitis C is treated with medications. There are vaccinations available for hepatitis A and B, and other forms are treated with hydration, rest, and by eliminating the causes of aging. All right, so July 28th is World Hepatitis Day, and for more information on this, you can go to the World Health Organization to find out, what these people are doing to help promote the awareness of hepatitis. Okay, any other questions? If you do have more questions, here are some of the references that we used. They're listed here below. And for more information, I included some links so that you guys can click on if you're interested in more. It'll just give you more information about hepatitis as a whole.